Some people are always grumbling because roses have thorns. I am thankful that thorns have roses. We're all survivors. I'd like you right now to think of one person in your life that you think is a survivor or someone that you've read about. So think about that person for a second. Now I want you to think about what qualities does that person have. That person is a survivor. Think of at least 2 qualities survivors have. And I want you to hold those as we go through the next few slides. Because my point is, it doesn't matter what you survive. If it's a DVT, a PE, whatever it is, we all have the same qualities. I mean, it doesn't matter if it's Katrina. It doesn't matter if it's the bridge collapse. It doesn't matter if it's a world war. And this is a World War II memorial. It doesn't matter if it's breast cancer or any other colored ribbon that's out there for any diseases. But you know what? We're here because we're survivors, and we're here because of the National Alliance for Thrombosis and Thrombophilia, who wants to reach out to patients and family members and friends and health professionals. The NATT mission is very simple. It includes prevention of thrombosis and thrombophilia, diagnosis, treatment, research, advocacy, and last but not least, and this is where I start cheering, patient and family support. And why do we need that? Venous thromboembolism, that's the VTE, which is DVT and PE, they're chronic issues. For pulmonary embolism, some survivors of pulmonary embolism are physically limited. For DVT, some individuals have ongoing extremity pain and swelling, and that's called post-thrombotic syndrome. You've heard about that this morning. Risks. The risk for recurrence of a pulmonary embolism or a DVT is high. It's about 30% over 10 years. The long-term anticoagulation therapy may pose risks of bleeding for some people. We know these things, but what we don't need to do is this. Stress about it. We just don't need to stress about it. Why is that? Being diagnosed with a clot can change our lives. It changed my life. And I'm going to talk a little bit about change, because people react to events that change their lives with a flood of emotions and a great deal of uncertainty, and that is normal. People generally, we know, also adapt well over time to life changes and stressful conditions. And how do they do that? They have the courage to come back, and that's what resilience is. So when I think of all of you who raised your hand in my introduction, what I think of is resilience. There's 10 ways, according to the American Public Health Association, that we can build resilience, be it resilience to blood clotting or resilience to anything that challenges us in our lives. And looking at what resilience is, this is a definition. They call resilience in the literature mastery against adversity. And they said this in the quote on the slide, the surprising finding that resilience is common and even expectable, even in the face of severe adversity, has been described as ordinary magic. So there's a lot of ordinary magic in this room, but the question is, how do we get that ordinary magic? How do we get that resilience? We get that resilience, and you've heard about it in the survivor panel, and you've heard about it talking at the tables and with each other today. We get resilience by taking control of our health and being advocates for ourselves and being at places like this forum to learn as much as you can about thrombosis and thrombophilia. Louisa May Alcott, who wrote Little Women, Little Men, Little Grandfathers, all those books, she said, "I'm not afraid of storms, for I am learning how to sail my ship." And that really is what it's about. There's 10 ways to build resilience. And I'm going to go through the 10 pretty quickly, but I'm going to really focus on the last one. The first way to build resilience as survivors is to avoid seeing crisis as an insurmountable problem. Accept that change is a part of living. Move toward your goals. Take decisive action. Look for opportunities to get to know yourself. Nurture a positive view of yourself. Keep things in perspective. Maintain a hopeful outlook. Take care of yourself. And last but not least, make connections.